Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Is diarrhea contagious? Diarrhea is usually contagious when it is acute, meaning it comes on suddenly. Acute diarrhea is often caused by a microorganism such as a bacteria or virus. These microorganisms can be easily passed between people or even between animals and people. Chronic or long-lasting cases of diarrhea are more likely to have causes that are not contagious. /r/n/r/n Diarrhea is defined as loose or watery stool that occurs 3 or more times per day. /r/n/r/n This article covers infectious diarrhea, its types, causes, treatment, and prevention. It also discusses how you can tell if diarrhea is contagious and how long you can expect symptoms to last. /r/n/r/n The most common causes of diarrhea are viral, bacterial, and parasitic infections. Infectious diarrheal diseases are contagious, meaning that they can be spread between people. /r/n/r/n Diarrheal infections are typically spread through the fecal-oral route. This means fecal matter that has infectious particles in it gets on a surface or person. Things that people touch a lot like doorknobs, buttons, and counters can be easily contaminated. /r/n/r/n If someone doesn't wash their hands after using the bathroom, they can spread the infection when they touch other people, for example, by shaking hands. Once the virus is on your hands, it can be easily transmitted to your mouth in a number of ways such as biting a fingernail or eating finger food. People can also catch infections that cause diarrhea if a sick person makes food for them. /r/n/r/n Kids can get infectious diarrhea easily because they tend to put their hands and objects in their mouths. /r/n/r/n Animals can also contaminate sources of water and surfaces with pathogens that spread infectious diarrhea. These illnesses can be transmitted easily when people don't wash their hands after touching an animal. /r/n/r/n There are two terms you may hear that are associated with infectious diarrhea. /r/n/r/n Infectious diarrhea often comes on quickly and does not last longer than a few days, though some illnesses may cause diarrhea that lasts a week or two. /r/n/r/n Once the cause is found, most infectious diarrheal diseases can be treated. However, some types of infectious diarrhea are harder to treat. People may have diarrhea that lasts a long time and leads to complications. /r/n/r/n The amount of time during which you can spread infectious diarrhea to other people depends on what is causing it. You might still be able to spread the infection for a few more days after you start feeling well. /r/n/r/n Viruses are the most common cause of diarrhea. There are 4 specific viruses that most often cause infectious diarrhea. /r/n/r/n Infectious diarrhea caused by a virus is usually highly contagious. /r/n/r/n This video has been medically reviewed by Robert Burakoff, MD, mile per hour. /r/n/r/n Bacterial diarrhea is a major contributor to illness and death worldwide. Although less common in the US than viral diarrhea, bacterial diarrhea disorders more often lead to dysenteric disease due to the development of ulcers and inflammation in the intestines. Dysenteric disease is an infection that causes diarrhea containing blood or mucus. /r/n/r/n These bacteria commonly cause infectious diarrheal disease. /r/n/r/n Bacterial infections that cause diarrhea can spread quickly between people, but it's more common for people to get sick after drinking water or eating food that is contaminated. /r/n/r/n Protozoa are the primary cause of parasitic diarrhea both in the US and around the world. These single-celled organisms come in many forms. Among the 3 most common causes of parasitic diarrhea, /r/n/r/n infectious diarrhea caused by parasites is usually transmitted through infected drinking water. /r/n/r/n infants and young children who go to daycare or preschool are more likely to catch contagious diarrhea illnesses. Things like sharing toys, contact with others in confined spaces, diaper changing/potty training, and inadequate hand washing amongst kids make it easy for germs to spread. /r/n/r/n diarrhea can also be non-infectious. People with medical conditions affecting the digestive, immune, or endocrine, hormone, systems can have diarrhea as a symptom. Diarrhea caused by these conditions cannot be spread to other people. /r/n/r/n medical conditions that can cause non-infectious diarrhea include /r/n/r/n people with these conditions may have acute episodes of diarrhea when the disease flares up, or they may have chronic diarrhea that lasts a long time. /r/n/r/n for healthy people, occasional diarrhea usually doesn't last long and gets better on its own without causing major problems. However, diarrhea is the second leading cause of death in children in the developing world. It's also a major contributor to work absenteeism and loss of productivity in the United States workforce. /r/n/r/n the elderly, very young children, and people with compromised immune systems are especially vulnerable to diarrheal infections. They are at an increased risk of complications related to severe diarrhea including dehydration and the need for hospitalization and fluid management. These groups are also more likely to die from complications. /r/n/r/n determining whether the diarrhea is infectious, how long it will last, relevant treatment, and preventing its spread, depends on the cause. This requires seeing a healthcare provider. /r/n/r/n because the symptoms of infectious diarrhea can be similar to non-infectious diarrhea, you may not be able to tell what you have based on how you feel. And if you have an infection that's causing diarrhea, you won't necessarily know which pathogen is causing it. /r/n/r/n to diagnose infectious diarrhea, providers will gather information from a patient such as whether they have been around sick people or traveled recently. They can also run a series of tests to identify the cause of diarrhea. /r/n/r/n finding out whether diarrhea is infectious or not has several steps. /r/n/r/n the treatment for diarrhea depends on the cause and how sick a person is. /r/n/r/n medications can treat infectious diarrheal diseases. For example, antibiotics and antivirals can treat bacterial and viral infections, respectively, while antimicrobial agents can treat diarrhea caused by protozoans. /r/n/r/n antidiarrheal medications can be prescribed along with oral rehydration therapy to prevent or treat the loss of fluid from diarrhea. The fluid can also be delivered intravenously, through a vein, if the dehydration is especially severe. /r/n/r/n you may have a fever with infectious diarrhea and feel sick. An over-the-counter, OTC, fever-reducing or pain-relieving medication may help. /r/n/r/n here are a few tips for preventing diarrhea infections at home and while you're out. /r/n/r/n acute diarrhea, the kind that comes on suddenly, is most likely to be contagious. Viral, bacterial, and parasitic causes of diarrhea can be easily spread from person to person. /r/n/r/n children, the elderly, and immunocompromised people are more likely to contract and spread these diarrheal illnesses. They are also more at risk for complications and death. /r/n/r/n see a healthcare provider if you fall into any of these groups, if you have diarrhea that doesn't seem to be getting better on its own, or if you have symptoms of dehydration. Your healthcare provider can treat severe diarrhea with medications and fluids. /r/n/r/n some of the germs that cause infectious diarrhea can be spread through the air when someone vomits and the particles become airborne. /r/n/r/n some infectious illnesses that cause diarrhea do not always cause a fever. For example, you might not have a fever if you are sick with norovirus, Stomach flu, which is highly contagious. /r/n/r/n Acute diarrhea usually lasts a few days at most. Chronic diarrhea lasts for 4 weeks or longer. It can also come and go. /r/n/r/n Your provider can test your stool and see if it has germs like bacteria or parasites in it. There are also blood tests that can help your provider see if you have a virus. /r/n/r/n Antibiotics are only used when diarrhea is caused by bacteria. 3 examples of antibiotics that are used for acute diarrhea include ciprofloxacin, cephalosporin, and azithromycin. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.